Well, good morning, everyone. It's wonderful to be with you all here today for our weekly media availability and press conference and announcement about some really important things that are happening in the city. And today we're also going to talk about some important things that happened at the state level in last week with the General Assembly. Some really powerful initiatives that occurred last week that are going to help move Louisville forward significantly in the years ahead. I also want to thank Councilwoman Josie Raymond for being here with us today. It's great to be in your district and on this beautiful early spring day. So thanks for joining us. Protecting public health and safety is our number one priority. It's the goal of everything that we do at Louisville Metro Government. And so we're going to focus today on several updates that related to improving public health and safety. And before we get to those, one of the things that I want to talk about to help protect everyone is severe weather. First, my condolences, thoughts, and prayers go out to those across the South and Midwest that are dealing with the fallout from the devastating storms and tornadoes that hit last weekend. I'm very thankful that the damage that we suffered here in Louisville we certainly avoided the worst. But that last weekend is just another reminder that here in Louisville and across the Commonwealth, severe weather can happen this time of year and any time of year, and can have dangerous and horrible impacts on people across Louisville. A few weeks ago, I officially recognized March 1st to 7th as Severe Weather Awareness Week. So I'm asking people to just take a moment to make sure you're prepared for if and when severe weather happens again in our city. Please have a plan for if tornadoes happen to strike again in Louisville. Make sure you have an emergency supply kit for your family that you know where lights might be or your backup lights are in case your power goes out. These things can be life-saving. Also, be sure to sign up for LENSAlert. We now have 70,000 people that subscribe to our free LENSAlert system to keep them updated. That's more than double the number that were here last year. And I'm really proud of that great progress so that more people can stay up to date. But with 70,000, we still have a long way to go to get even more Louisvillians signed up for this free emergency system. So please sign up for LENSAlert today. You can certainly benefit that. And also, I just want to thank everyone here at EMS at the headquarters. We're going to be talking a lot more about a great new EMS program today. But thanks to everyone with EMS, our 911 dispatchers, to our firefighters, to our police officers, and everyone in public safety and our first responders that help us when severe weather strikes. Thank you so much for your service. And speaking of some of the great work that our 911 dispatchers and EMS and police and others are working on collaboratively is a new important program, not new anymore, that we've been working on for 2 years. And that's our Crisis Call Diversion program, or deflection program as we often refer to it. It's an alternative response model created by our city that allows social workers and other mental health professionals to take over for certain 911 calls instead of having the police respond. This means that our police officers can focus on the work that we want them most focused on, and that's preventing and responding to violent crime. And it also provides enhanced services to individuals who are in crisis when they themselves are calling. That means we use our resources at Metro Government more effectively and efficiently to provide better services for people across the community in need. A couple weeks ago, I spent some time working at 311 with the call takers there at Metro Call 311. And an individual there called who was having a mental health crisis himself. And I was able to connect that individual with our deflection program to get him the help that he needed in that time of crisis that he was dealing with. This program was launched in 2022 in partnership with 7 county services. And since then, it has been an amazing success that I am proud to have continued to invest in, to continue expanding across our city. As of last summer, I announced that it would be going to 24 hours, 7 days a week in all 8 of our LMPD divisions. And since it's launched, the program has deflected over 7,000 calls. So again, this is 7,000 calls where police officers would have responded that mental health professionals have now been able to better help individuals in need. The data is showing that the programs work, And so I'm excited to announce that we are expanding this program once again. The deflection program has now expanded to our entire city, including all the smaller cities with their own police departments that had not been a part of the program. So places like St. Matthews and J-Town that had this was only going into LMPD divisions, now it is serving the entire city, the entire county, working in partnership with everyone to serve every resident of Louisville with the important program. So I'd like to thank again my colleagues at EMS, MetroSafe, 7 County Services, LMPDs, and all the other police departments across Jefferson County that are working together to keep the momentum going, to keep this program expanding and helping others. To speak more about the effectiveness of this program, I'd like to welcome Sergeant Pam Oberhausen from LMPD to talk a little bit about the impact that this deflection program has made.
I'm very proud to have been a part of this program, a small part, since the very beginning. This is just an invaluable program to the police departments across the entire, Jefferson County area. When you think about what police are needed to do, you think about emergency situations. Now, even though that we are trained in crisis intervention team, deflection team just hit 1,000 runs, 1,000 calls just recently. Now think about that, because this uniform right here that I'm wearing, this outfit that I'm wearing, to a lot of people represents stress, anxiety, fear, mistrust. And even though I'm trained to de-escalate as a CIT officer, me showing up in this uniform is already not a very good thing for a lot of people. And it is a stigma. It's a stigma that you did something wrong when you're in crisis because I'm a police officer showing up. Deflection takes away the stigma, and that's overall what we're trying to do with mental health, is take away that stigma. They can do that. But along with taking away the stigma of mental health, what they've done is they have other resources. If I take you to the hospital or take you someplace that it's just kind of done. With deflection, they follow up. They do follow-ups with the people that they encounter. And how important is that when you have someone who's in crisis, which means they probably feel very alone? How important is it to have someone to come back and find out how you're doing and do a follow-up with you? That in itself is just amazing at breaking the stigma. So this program is great for the police departments. It's great for the community because it keeps us on the street to respond to those emergency situations that we need to. It's great for the families of mental health consumers who have been worried about when police come to the runs, worried about how that's going to go. And they don't have to worry anymore with deflection. And it's also great for the mental health consumers, for the mental health the people that are in crisis, because again, they already have enough stigma on them. They don't need any more. And deflection takes away that stigma that unfortunately society places on people that are in crisis or have mental health conditions. So it's a wonderful program.
Thank you so much, Sergeant Oberhausen, and thanks to all of our friends at 7 Counties for the great partnership that we have for this program. And I really do encourage people to use it if you're feeling like you need help, or if you know others that are in need of help as well. Please reach out. Right now in our community, we've got great positive momentum with reducing the amount of violent crime, where homicides and shootings year to date are significantly down year over year. Unfortunately, suicides are up this year. And so I do want to encourage people to seek help. Seek help. If you feel like talking to someone can help improve your life or help improve the life of someone else that might be dealing with a mental health crisis or issue, please reach out, whether it's to our deflection program or other mental health providers. We want to provide that help. Thanks to everyone who's helped make this program so successful. We're going to continue doing this. And that brings us to another great project that I'm really excited to announce. If our whole EMS team and Dr. Smith can join us for this. Just like when we started deflection and doing some innovative things and seeing what's working in other parts of the country that we can use here in Louisville to help serve our community. I want to talk briefly about another amazing, first of its kind in Kentucky program that we're launching here at Louisville Emergency Management Services. My colleagues at EMS respond to over 120,000 calls for service each year. And during medical emergencies, they use cutting-edge technology to offer high-quality, life-saving care. And they're always looking for ways to improve. I really appreciate that about my colleagues at EMS. For example, the leading cause of preventable death in trauma victims is the loss of blood. And recent studies show that for every minute a traumatic bleeding victim doesn't get blood, mortality odds increase by 2%. Literally, every minute counts. You've heard that before, and research clearly backs that up. So today, I'm proud to announce, along with my colleagues from EMS, that Louisville Metro EMS will be the first agency in the Commonwealth of Kentucky to deliver pre-hospital blood and blood products to patients in the field. I want to thank the team at EMS, including EMS Chief Jesse Yarborough, Major Aaron Spurka, and Raymond Orthober for their work to make this happen. And after the conclusion of the Q&A session we have with the media, they're going to give a demonstration and answer questions about this great new program. I also want to thank the American Red Cross, who is partnering with us on this project. Once this program starts, we'll be about one of 230 EMS entities in the entire country who provide this service. That's less than 1% of all agencies nationwide. Again, less than 1% of EMS services nationwide are providing this service that we in Louisville are now going to provide. In other cities where blood is being used in the field, the results have been very clear. Trauma patient survival rates have improved an average of 75 to 85%. And this program is expected to start on April 12th, the day of Thunder over Louisville. To talk a little bit more about this program and what it can do for patients, I'd like to introduce somebody who sees patients being brought into their hospital every day by ambulances, somebody who is a healthcare hero that has done so much to save so many lives all across our city, Dr. Jason Smith from U of L Health.
Well, thank you all very much. About 12 years ago, a group of trauma surgeons at the University of Louisville joined a group of healthcare systems around the country to begin to look at how we might utilize the hard-earned lessons from the global war on terror to better the care of trauma patients. One of the things that came out of that around 12 to 10 years ago was the use of pre-hospital blood and what we might be able to accomplish. Fast forward 12 years and the data has become quite clear that, as the mayor said, the sooner we can transfuse someone, the better their chances are of living through their trauma. I am so proud to be a part of this community and the EMS services who have joined the cutting edge of programs around the country that are taking this step. I think you can't thank them for their dedication and hard work more than I already have, but I'll try. And I also want to thank the Red Cross, because blood is a precious commodity. Just when we need it most, we are oftentimes seeing the least amount of donations, and we have to utilize that to the best of our abilities. And so the EMS services and the Red Cross working to move the blood into this program, back into the hospitals, and getting it to the patients that need it most really represents the pinnacle of what we should and can be able to do in this community. So I will say, in my not so humble opinion, this is literally one of the very best EMS providers in the entire world, and I want to thank them for what they do every single day.
Thank you so much, Dr. Smith. And again, my colleagues from EMS, Chief Yarborough, Major Spurka, Dr. Orthober will all be available afterwards to show you how this works and to answer any of your questions. Thank you all, and to all your colleagues, so much for what you all are doing. I also want to add that EMS is hosting blood drives today and next week. So please register if you're able to give blood. As Dr. Smith mentioned, blood is certainly a precious commodity. Before I take questions, I want to talk about two other topics in our community. First, I want to talk about some of the great things that we were able to get accomplished during this year's short session of the General Assembly. There are still 2 days left, but last week was an incredibly important week for the city of Louisville. And just for context, before I was mayor several years ago, for some in our city, we thought that saying Louisville and Frankfurt was like saying a 4-letter word. We've worked incredibly hard over the past 2+ years to strengthen relationships with our colleagues in Frankfurt and people all across the state so that we all understand how we can each help one another, that Louisville's success is the Commonwealth of Kentucky's success and vice versa. And we're starting to see that pay off. We saw that pay off in last session with over $100 million invested in our downtown, $1 billion committed to our community. And in this non-budget short session, we have made some great steps forward, in particular to strengthen public safety and to spur major investments in downtown and housing developments. And so I just wanted to give a brief overview of some of these important legislative things that happened last week that are going to help us revitalize downtown, build more housing in our urban core, and strengthen public safety. Just briefly, the Arena TIF has been around for many years and has helped get the great KFC Yum Center built, and it's doing wonderful for our community. However, an unintended consequence is that it's made it difficult to provide incentives to develop other major projects in downtown, particularly on surface parking lots, including surface parking lots that are owned by the city, that are generating no taxes or no revenues for the city, for the state, or the arena. Now, thanks to House Bill 775, we have a new tool available to make projects like the Diamond District right next to Louisville Slugger Field, this new mixed-use community, happen on a city parking lot that's sitting vacant far too many days, will now become home to people that are living there every day, people that are going to restaurants, that are staying in a hotel, and creating jobs for our entire community and creating new tax revenue for the city, for the state, and the arena. Similarly, because of challenges in the TIF law, the vacant lots at 7th and the River, the old Museum Plaza site, have a new tool available to help build a major development there. We passed legislation that are going to help attract and retain multi-day festivals that have over 60,000 people. So great festivals like Bourbon and Beyond and Louder Than Life now will want to stay here with this great new incentive, and we can attract more to come to our Commonwealth. On the housing front, we've been able to do some things that are expanding the tools to help make it easier to build more housing in our urban core. Things like expanding the use of industrial revenue bonds and providing more affordable home ownership opportunities by helping turn abandoned and vacant houses into new homes for people. And also, again, with tax increment financing, it really didn't help support urban housing developments. Now we've tweaked the definition so that urban housing developments, just like other types of projects with offices and hotels, can benefit from this important tool. Take that all together, we really have some great new tools and resources. I want to give a special thanks to Senate President Robert Stivers, to Senator Julie Rocky Adams, over on the House side, Speaker David Osborne, Representative Jason Nemes, members of both the Republican and Democratic caucus from Jefferson County, who worked together with us to pass this incredibly important legislation that is going to help us create jobs in Louisville, create new economic activity here in the heart of our city that'll benefit Louisville and all of Kentucky. And then also on the public safety side, a couple of important new tools that we have to help continue our effort to crack down on copper theft, to ensure that stops, and also to help protect our vacant and abandoned properties and to reduce the amount that are plaguing our communities. So those are some of the great things that happened in the legislature. Let me be clear. There were some pieces of legislation last week that I certainly do not support. But focusing on these positive economic development and public safety initiatives are going to help move Louisville forward. And finally, to end on a fun note, before I take any questions that you all have, this weekend, we're getting ready to kick off. Last weekend, we kicked off the racing season for our soccer team. This weekend is Lou City's home opener. Saturday at 4 p.m., we're going to have a very special guest at the home opener. Louisville's own My Morning Jacket, and we'll have a special halftime presentation for them. So I want to encourage all fans of soccer, all fans of Lou City, all fans of My Morning Jacket in our great city to join us at Lynn Family Stadium Saturday at 4 p.m. for this special presentation and great soccer game that's just kicking off the wonderful season. And of course, go Cards. So with that, happy to take any questions from members of the media. Eleanor.
What is your stance on that bill, and do you believe Louisville can run for those districts?
So the question was about a bill that was introduced last week regarding changing the short-term rental laws in Louisville and Lexington. Excuse me. I think what we have in Louisville right now is working. We've made substantial strides. That bill, by the way, did not pass last week. And so right now what we have in Louisville, our local ordinances are working. We are permitting Airbnbs and other short-term rentals to be in parts of our community, but there are rules about that. And so I am supportive of the way it is now. If there are ways to improve that, I always want to engage in those conversations. If there are concerns that others have, we need to continue to hear that. But that bill did not pass last week.
One more, you mentioned SB 129. That would also prohibit Louisville from rezoning by right. How do you think that could impact our rural housing efforts?
Yeah, so there are certain things. I touted some of the things that are really going to help us, particularly with housing in the urban core. There's no doubt there are some parts of that bill that do make it more difficult to develop in parts of our community. And so we are going to, of course, follow this law. We'll continue to work to make it as easy as possible within state law to build more housing across this community, because we need more housing of all types in every neighborhood. We need more single-family homes. We need more apartments. We need more duplexes. We need more ownership opportunities and rentals so that we can bring down the cost of housing for everyone in our community. With costs rising, we're working to bring that down. So we'll work within those confines. We're going to continue to work with the state legislature on we understand what their concerns are. We're going to be focused on encouraging investments in the urban core here, given these new tools that were provided.
Yes. A couple of months ago, you found $5 or $6 million in the budget to go to the fire department. What's happened to that money so far?
So that money has been allocated to the fire department. Some of it is to improve the quality of firehouses, and I believe some of that work has begun. Some of that was from new equipment and apparatus. Part of the challenge in the fire department is that there's a long lead time to actually get the new equipment in once you make the purchase, and we can't make the purchase until we know the funds are available. And so thanks to working with Councilwoman Raymond and her colleagues on Metro Council, we made these investments in the fire department. And so that is, it's underway. I can get you more details on each one of the specific projects if you'd like.
There's a video going around where there's some trouble at the bus station. I know you don't have direct control over bus station employees, but is the police department down at the bus station more often?
I'm not familiar. The question was about some issues down at the bus station. I'm not familiar with the particular incident that you're addressing, but if there are public safety issues, whether they're at a bus station, at a church, at businesses, on neighborhood streets, LMPD needs to be there and will be there. So I'll look into that specific issue. I'm not familiar with it. Sure. Anytime.
Copper thefts, we've reported extensively on that. How many arrests have been made?
So we have made arrests. I don't have the exact number. I can get you the exact number, but literally days after we announced the creation of our critical infrastructure task force, which was focused on copper theft, we made some very significant arrests. And just about 2 weeks ago also, we made some very significant arrests of 4 individuals. We shared the video with the community of these individuals committing that copper theft in process. And now one of the pieces of legislation that was passed last week is to enhance the penalties for copper theft from our streetlights and broadband infrastructure. So again, we hope that this serves as a deterrent from individuals who have been doing that. But we have made significant progress in deterring copper theft and arresting individuals who are doing it over the past 6 months.
Any conversations with KYTC on getting the lights on the interstates fixed?
Oh, extensive. The question was about, have we had conversations with KYTC about getting the lights on the interstate fixed? We have had extensive conversations with KYTC on getting the lights fixed, on getting the highways cleaned. They did a nice job plowing the roads, but there's lots of other things that we need their support on for the highways that run through Louisville. So yes, they're very well aware of it. Addressing copper theft is one of the ways that we're addressing that, so that they don't go out when they get reinstalled. They've also started a new pilot program. You can see down on the 22nd Street ramp where they're trying some lights that actually don't have copper in them that are solar powered as well. But we continue to encourage them to get all lights fixed on the highway. And we're working with LG&E right now to improve, to reduce the number of outages on streetlights across our entire city. We just had a great meeting with them last week to make improvement in that area too. The question was, did Danny Wimmer Presents indicate that they needed the incentive to continue to stay in Louisville? Yes. Danny Wimmer Presents brings hundreds of thousands of people to our community every year. It's a huge economic driver every September in Louisville. The cost of putting on these festivals is rising for a lot of different reasons. They're getting incentives from other states and cities that they have other shows in across the country. And so they needed this to continue to stay in our community. I was proud to support this. I'm proud that it's going to support those two festivals, maybe even expand, and also can help other festivals that we can bring to Louisville and elsewhere around the state.
Did they explicitly tell you if they were thinking about not renewing, or do you think if they didn't get this specific legislation passed?
Yes, they did have questions about their long-term future in our state. Now, between this legislation and some other good things that are happening, I think we have a good announcement coming soon. So stay tuned.
Question on the SB 129 HB 18 combination bill. The moratorium on the land development code change was lifted, but then, as Elmer referenced, the MRDI process is going to be made more cumbersome. Overall, do you think that bill moves affordable housing forward, or does it just keep the status quo?
So the question was about Senate Bill 129, formerly House Bill 18, and overall, given some of the changes, do I think it helps affordable housing? Yes. I ended up supporting this bill in the current form because while I might not agree with every provision, I do think that the new tools that are in here, the new provisions, give us more ability to build more housing in our community with a specific focus on our urban core. And I'm hopeful that that brings down the cost of housing and creates more housing so we can create more good paying jobs across our city.
And with the expansion of the deflection program, how do you encourage people to call when they're experiencing a mental health crisis?
It's very easy to use the deflection program. All you have to do is call 911, and our great dispatchers will answer the phone and ask some questions right at the front to determine whether you're a candidate for the deflection program and connected with a mental health professional, or whether you need the police to come out to your home or wherever you are in case of crisis. So it's as easy as calling 911.
Do you have a position on what ought to happen to the St. Paul church that was damaged by the fire? Obviously.
The question was about St. Paul's Church on Broadway, right there at the southern part of the LUMED district that suffered a fire not too long ago. My first focus is on public safety, is to ensure that people don't go back into that building. Right now, it is not safe, but I also would like to preserve as much of that building as possible. We probably need to see a new owner of that property, but again, we need to focus on public safety first. But I am hopeful, just like in my career prior to becoming mayor, where we were able to save some great historic buildings that were not in a wonderful condition and restore them back to life with the great historic character that they had. I'm hopeful that that can be the case at this property as well. You know, that fire was actually one of the fires, one of the incidents that led to the passage sponsored by Emily Callaway. It ended up being in Senate Bill 129 of the negligent landlord enforcement provisions that now give Louisville the tool when there are negligent landlords that are not keeping up their vacant or abandoned properties. If fire has to go out to deal with an issue like they did at the St. Paul's Church on Broadway, we will now be able to seek reimbursement for those public resources, for the cost of those emergency responses. We need our property owners to keep up their property. They did not at St. Paul's Church, and I'm hoping we can still preserve some of the church. Thank you all very much.